is Money Talk Radio, AM 740 WSBR Boca Raton and WPOW HD3, Miami, Fort Lauderdale.
Here's the latest from ABC News. I'm Joan Bennett. UN weapons inspectors have left Syria and are on their way back to Europe with results of their investigation of chemical weapons allegedly used by the Assad regime on Syrians. Meanwhile, President Obama ponders a possible military strike on Assad's forces. ABC News consultant, retired Marine Colonel Stephen Ganyard.
They'll go after the unit that conducted these attacks on the civilians, but they'll also do something that's very visually compelling. Well, they'll level probably a Ministry of Defense building or something that's visually iconic, and they'll be able to show the world that the United States has conducted this military strike.
U.S. warships carrying cruise missiles are on standby in the Mediterranean. Air quality officials in Central California say a shift in the wind has sent smoke from the massive rim fire into 6 counties in the San Joaquin Valley. They're advising residents who smell smoke to stay inside. Assistant San Francisco Fire Chief David Franklin.
When 187,000 acres of brush and heavy timber burn, it's going to give off a lot of smoke, and that's why we see the large column of smoke columns.
An elementary school principal in Bakersfield, California, is behind bars facing first-degree murder charges in the death of her husband, found gunned down in a field Sunday at Fairview Elementary, where 46-year-old Leslie Chance worked. Teachers are stunned, says Assistant Superintendent Ken Chichester.
Shock, disbelief, and people feeling like they got the wrong person, made a mistake, just kind of out of character.
As a new school year gets underway, concussion prevention is being taught to high school football players. A recent study found more than 140,000 young athletes suffer concussions every year, the majority football. Endurance swimmer Diana Nyad, who recently turned 64, will attempt for the 4th time to swim from Havana, Cuba to the Florida Keys, starting today. This is ABC News.
When you want to know what the best product is, you ask an expert. So if you want to know why the Exergen Temporal Scanner Thermometer is the best for you and your family, just ask doctors and nurses why they use it at work and at home, and they'll tell you. The Exergen Temporal Scanner Thermometer gives a fast, accurate reading with just a gentle forehead scan and is backed by more than 40 published medical studies. Those all add up to peace of mind that your family is using the best and a great value for the money. Get yours today at Costco and other fine retailers.
Trying to sell your old car? Instead, donate your vehicle to Heritage for the Blind. Pickup is free and your donation is tax deductible. Just call 1-800-895-8035. Heritage for the Blind accepts cars, vans, trucks, and boats, whether they run or not. Donate your vehicle and you'll receive a free 3-day vacation voucher to over 50 locations. Call 1-800-895-8035. That's 1-800-895-8035.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
So, welcome back.
Welcome back, and so we want to finish with my knee?
Welcome back, and welcome my back.
Welcome your back, welcome my knee, right.
Let's welcome your knee. Okay. So let's go back to your knee. So right, an abrasion, we were saying for the people that just tune in, there are people that set the alarm clock by this show.
That's right.
So
and they do.
Richard set that cup of coffee by this show. He just grabbed that cup of coffee at 0700 hours.
Listen, he's here at 4:30 in the morning. He's great.
No, but that cup of coffee don't start until 0700, right?
He's very happy now that but he's very happy with the association with a wonderful woman now that he lives at her home. That's really been a great thing for everybody.
Excellent. So
back to my knee.
So back to the knee. So if the abrasion happened to be on a joint, like for example your elbow, in your case, the knee, you need to be very cautious because those ones can be very dangerous. If the abrasion usually can get infected, and sometimes you get the doctor to start you on antibiotic because it's getting infected now. So it's no longer with local treatment, now you need systemic treatment. And a way that I explain it to patients is you have a wound and we need to hit it from the inside as well as from the outside. So the local treatment is hitting the wound from the outside. The systemic treatment, the tablet that you take by mouth, or if you get an injection in your butt of antibiotic, basically the antibiotic is trying to work from the inside to contain the infection, prevent it from going to other tissue like a bone or inside the capsule of the joint, because then it becomes a catastrophe. A lot of time when a joint like that get infected, like the knee, you have to just open it up and leave it open. And you cannot walk on that joint, so it can become a big catastrophe. In your case, I just saw that wound is healing nicely. I think you're doing a great job. A lot of people want to run with antibiotic because that's the way our society has trained us. Go with natural stuff. Go for Aquaphor. Go for aloe vera. Go with natural thing that will just take the skin and will help the skin heal itself. The good thing with aloe vera and Aquaphor is that even Vaseline, while you go and get your Aquaphor, if you have some Vaseline at home, just put it on and then go and get Aquaphor or aloe vera. They're much better than just plain Vaseline. But the Vaseline at least will be like a bandage to protect from the outside environment. And the Aquaphor and the aloe vera will do the same thing, except that it's helping the skin heal itself. When do you want to go for antibiotic? If it's getting infected, then you need to start applying antibiotic. Another thing that you did, immediately you put pressure on the wound and you cover the wound, and that's fine. As soon as you see that the wound starts healing, you want to let it air. So don't keep covering a wound because you have it there, unless you happen to go out to an event and you don't want to have that exposed. You don't want people to look at your wound, so then go ahead and cover it up. But if you want the wound to heal fast, then go ahead and let it air. Don't cover the wound, just treat it twice a day or 3 times a day with aloe vera or Aquaphor, and it will heal nicely without having to cover. The problem with covering the wound, sometimes people just wrap it so much that the area starts sweating, and then that moist can be a petri dish for fungus and bacterial infection to grow there. So it's better to let it air, leave it open, don't cover the wound, don't make it moist, and it will heal so much faster.
So the Neosporin I was thinking that was what was important.
Sound like a typical American.
No, I mean, I put it on, I was afraid.
Aloe vera.
Yeah, I did that, but I was afraid. I thought I was supposed to put something on to keep it moist, and the aloe vera dries very quickly.
Exactly. The aloe vera dries quickly, so you do it more often. You just carry a little aloe vera in your purse.
No, I get the natural. No, I have the plant. I put it directly from the plant.
Perfect.
That's what I always keep, an aloe vera plant. Okay, well, thank you very much. I almost called you. And the other thing is, when I had the accident with the car, I went to the hospital. I had gotten tetanus shot. And so I didn't think I needed one for this.
No, every 10 years. So if it's within 10 years, then no, you don't need another tetanus shot. That's enough.
Right.
Good job.
Okay, good job. I've been with you long enough. I'm becoming your nurse.
So when people come to the open house, they can say, Anita, can I look at your left knee? Let me see that wound Dr. Mencia was talking about.
Look at my wound. Well, that's good. Well, the big thing is now it's going to eventually fall off. I have to be careful. I'm not picking it at all.
No,
I know. I'm not picking it.
You want to leave
but I want it to eventually to come off. But it's still tender. It's interesting.
Of course.
It'll be okay, though.
And then the other thing that sometimes people get scared, you get in the wound after 2 or 3 days that pulling motion, you feel like something is pulling you inside there.
Yes, that's what's happened.
And what's happening is the tissue are trying to come together. The cells are multiplying like crazy in there. And you see a ligament and a tissue just holding on to each other. So it's like if you're sitting across the table from me and I'm sitting here and we grab each other's hand and we keep holding tight to each other so we don't split.
So that's why I'm feeling this too, because at first I didn't have any of this pain, and now that's what's happening. They're trying to get together.
Absolutely.
I figured on my knee they're all trying to get together and have sex, probably.
You and I, they are trying to talk to each other.
They're trying to have sex on my knee. Okay, themselves.
And
having
your
fun.
husband on the other side. Get the guy away from here! Get the guy away from here!
Okay, so it's autumn. Is this autumn now?
It's autumn. So let's talk about September 6th. Open house.
Yeah.
Open house.
What's going to happen
We're
there?
going to be there. I don't know if Rachel is coming. I hope Rachel comes. September 6th, Rachel.
Right, from
open
4 to
house,
8.
4 to 8. It's going to be a wonderful open house. Everything.
Oh, everything. Dancing girls?
Yeah, dancing girls.
That's going to be...
We're bringing it from Las Vegas. Everybody unemployed in Las Vegas, we're going to tell them to come by and do a show for us.
Okay, so it's called Fusion Health, and it's right next door to you.
It's right next door. It's they can park right on our premises. So they can park there, and then we just walk over next door. It's 1586 East Commercial Boulevard, Oakland Park, Florida. For those of you that use your GPS for everywhere you go, 33334. I told one of my patients, if you're getting lost, just use your GPS. He said, no. She said, I get lost everywhere I go except coming to your office. My car knows how to get here.
Well, that's right. It's like that's the GPS. But so it's Friday, September 6th from 4 to 8 over there at Fusion Health, which is next door. What are they going to expect to see there? I mean, they're going to get to meet.
They're going to see something that is a new concept of healthcare. And what we are doing is basically fusing cardiopulmonary. They say pulmonary because, my dear friend, Dr. Keith Robinson, is a pulmonologist. But, from my opinion, this is my personal opinion. From my opinion, the lung and the heart, they are very intertwined. So really, when a lot of times a person go and they think they are having a heart problem, and they might be having a lung problem. So they are very intertwined. And then a lot of people end up having cardiac intervention like surgery and stuff like that, or catheterization. And their main problem, the root of the problem is not really the heart. It's just the expression, the worry go to the heart. Let me give you an example. If you have lung condition and you have problem breathing, the lack of oxygen might make you feel like you're having pain in the muscle, including the heart is a muscle. So the heart cannot be affected. But the pain can be on the muscle around your ribs, in your chest wall. And that pain in the muscle, when you go to the hospital, they're going to want to do a catheterization to look at the blood vessel. Well, guess what? If you do catheterization in 100 people without chest pain at the same age of that individual that's having problem with their lung, maybe 80% of them might have some sort of blockage in one of those arteries and they don't have any symptoms. But when you went to the hospital because you were having quote-unquote that chest pain, and they do the catheterization, they say, oh my God, this is the main reason why you're having the pain. They go there, they put a stent in there, and after the stent, you say, oh my God, I'm cured, I'm taken care of, you go home, the lung was never attended to, and now here you go after a while, you say, here comes the pain again. So the lungs are very important for the entire body. The lung is like the window from the inside to the outside. Because the air that you breathe that comes from the outside, go through the lung, it gives you the oxygen that the rest of your body will need, from head to toes. So the lungs are extremely, extremely important and underappreciated. So what Fusion Health is doing, say, we're going to work with the body, paying attention to the lungs. So the chiropractor will work with the back. Why? Because the nerves that go throughout your body, they all stem out of the back. So if your back is not well aligned, the nerve might be pinched, and you don't have to feel pain because it's pinched, but it's not sending message and receiving message from the rest, the area where that nerve is supposed to be innervating. So the chiropractor become an important component of lung care. The physical therapy, the yoga, because when we do Tai Chi, when we do yoga, when we do Taekwondo, we try to work with the breathing. We try to work in slowing down the heart rate by meditation and by relaxation. So we are working with the body and mind, the soul and mind, putting everything together into helping us relax. So it's like what we seen in Asian healthcare. So it's fusing the East and the West, bringing to the pulmonologist all of this like acupuncture, physical therapy, yoga, meditation, bringing all these things together under one roof, and then all of us working together trying to help a person with a lung condition breathe better. And by breathing better, then you are getting more oxygen. And another function of the lungs is to get rid of the waste material called CO2, carbon dioxide. So if the lungs are not working properly, you are retaining carbon dioxide. Carbon dioxide, if you start jogging and somebody put a gag on your mouth so you cannot breathe and you keep jogging, you're going to collect carbon dioxide. The carbon dioxide becomes lactic acid by the muscle. The lactic acid in the muscle, because it's an acid, will give you pain. So you see people that when they go out and exercise, they feel a lot of pain, and their problem might be because they are not breathing right when they are exercising. So imagine a person with a lung condition. They are always in pain. They have low energy. So the lung become very, very important in the brain and any organ in your body. So I think, Fusion Health, I wish them the best of luck. You and I are going to be there supporting their cause. And it's going to be a lot of people, so do come early. It's going to start around 4 o'clock. And come and see this new concept of trying to care for people, taking approach and looking at the lungs and how the lung intertwine with the rest of your body, and how can all these specialty are coming together to help people live better.
I'm glad that you're a part of this, and I know that it's very important because you've always done that with your practice. You've brought all sorts of specialists in there. But this is kind of maybe a missing piece that I never realized, that the pulmonary was so important, and that was my next question. When you have a new patient, how do you can't see in their lungs. How do you test their lungs?
Oh, that's a good question. That's a very good question. We have a little machine that we put sometimes on the finger, and it calculates the amount of oxygen that is circulating, like in the nerve bed, which is, where you have a lot of artery being exposed.
No, I don't know that.
So we have this little machine, and we put it right on top of your nerve bed, and it tells us more or less how much oxygen is really circulating to your body. And I had a patient that came in basically feeling that she thought she was having a heart attack. I almost called Dr. Robinson yesterday. I had him on standby. He said to my chief nurse, Juan, he said, if you need me, call me. I'm right next door. I'll come in. But we managed to take care of her. But when we did it's called a pulse oximeter, what that little machine can do. So we did a pulse oximeter, and the saturation on her was, usually you want to be around 99, 97, 94. She was 88. So that's significant. That's a big drop. Sitting down doing nothing, 88. I mean, she's not exchanging good oxygen. So at the nerve bed, she was dropping by about 10 points. So she was wheezing a little bit. I gave her a breathing treatment. I let her rest, check her heart. The electrocardiogram was fine. We gave her another breathing treatment, and she went from 88 to 98. And I asked her, Helen, how are you doing? Oh, Beatrice said, I'm doing great. I'm breathing better. I feel so much better. Can I go home? I said, yeah, in a little bit. And we treated her with an antibiotic. We took care of her condition, which was an exacerbation of emphysema due to a little bronchitis she was developing. Now, this lady is 94 years old, But she's so smart because she said, it's a long weekend coming up. I know if I get sick, it's going to be very hard to get a hold of Dr. Robinson or you, so I decided to come in and just get seen by you guys. And we went ahead and we took care of her, and we sent a nurse to start going over and seeing her, because in the facility they have these nurses that will attend to the patient. So we took care of all of that, and now we have a system in place, and she has an open door today. So Beatrice knows that if she needs something, she can just walk right in without an appointment, and she will be seen because we are open today. Because today is Saturday, and we are open on Saturday.
Yes, we are. We know you're open on Saturday.
And then also she's on the list of home visits for the weekend because of the long weekend. So she's on that list of home visits. She can make a phone call to the operator and say, can you have the nurse practitioner come and see me on Sunday or Monday? Fabulous. So that she will not get neglected. So my beautiful lady is looking good, and the weekend she won't feel so stressed out because we are going to be there one way or another for her throughout the weekend.
You brought up a very good point. Sometimes it's just the anxiety of not being able to have anyone for 3 days. So
absolutely.
Now she probably won't even need anyone because she knows she can get someone, right?
Yeah, absolutely. I had a patient that came to see me yesterday. I call her my aunt because she's been with me since I opened the practice. So she came to see me yesterday, and the main reason she came to see me is because she's so scared that she's constipated. Now, I have her on treatment. There's a new medication that came out for constipation called Linces. There's another one called Amethysa. And she's one of those few patients that take those two new medications and have her very well controlled. But she's so scared of the long weekend. Her companion won't be there because she's taking time off. And she's so scared. She came in really, really impacted. So we took care of her yesterday. We make sure that, she knows that we have an open door for her today. She knows that we have the visiting nurse coming. She knows that we have the nurse practitioner coming in. So she was more relaxed that say, I am not really being abandoned.
Yeah, that's really important.
And that's one of the key things of our practice. I think that's one of the
no
things that
feels
people
abandoned.
need to exactly.
That's a good word. We don't usually use that word in medical terminology. That's a very interesting word. I know you came with something to talk about, but I want to talk about the impaction. So you put her on
the impact of impaction.
Yeah, that's right. The impact of impaction. That's very good.
That's a good title for my next book.
That's very good. But this is my question. So why do people have to have medication? Why? We know that all sorts of seeds and things are wonderful, flax seeds, to make someone...
That's a great point.
Why do we have to put people on medication?
Because of the way it's our set of beliefs. You have like the wound. We were talking about your wound. We have the set of beliefs that we grow up with. As I was growing up, I remember in Hawaii, my mother, if I fell off the bike, she would go in the backyard and grab a few leaves and put it by the fire, then put a little bit of olive oil, and then she would put it on the wound. And I would feel that tingling sensation we were talking about that come 2 days later. I would start feeling that the same day. So she would do things from nature, from Mother Nature to cure. And I grew up with that set of value. And then going to school, I learned the other set of value of Western medicine. But I grew up with both the Eastern and Western in my life. Most people grow up with the Western in this country. So people feel that for any ailment, there will be a medication out there that will take care of you. But guess what? If you take oatmeal as a medication, if you take flaxseed as a medication, if you take high fiber as a medication, you can get cured also, except that you don't need a prescription for it. Sometimes I write it for my patient, oatmeal in a prescription pad, so they they buy into it.
That's right, but why? So this woman who's so upset, if you say to her what you just said, why wouldn't she? You just put her on some sort of kind of food that will make her.
Well, all of my patients, I tell them and I say, this is what I would do, and this is my recommendation, and give her a regimen. Then I put Nicole into the picture, and I say, come and see my dietitian. Let's work with my dietitian. we can talk about the guts. The guts are so important. We spoke about the lung, the importance of the lung. The guts are so important because the guts have two functions, just like the lung. At one side of the guts, you are going to take all the nutrients that you bring through your diet and absorb it into your system and then bring it to the cells throughout your body so that those cells stay healthy. The guts will take the rest of the food that you ate, and whatever is waste material is what you're going to put in the toilet. All that waste material need to come into the toilet. When you pass wind, those are bacteria in your guts that are creating this gas. And the gas that is created by the bacteria, that's how we pass wind, or farting. Talking about passing wind. You believe this, Richard? Saturday morning.
Kids love to say fart. They love that word. That's so much fun. Oh, yeah, they love this.
So imagine if your sewage system get backed up. The smell coming from that system. When it get backed up, it's horrible. You don't want to be around there. So your gut can get backed up the same way. It's called constipation. And we need to cleanse the gut. We need to make sure that your bowels are moving because you don't want to get backed up because it's detrimental to your health. It's not good. You get people that have chronic fatigue syndrome and they take medication for that. They might not need that. They need to clean their guts. If you clean your gut and you have your gut clean like a whistle, talking about passing gas, whistle, clean like a whistle, your gut will do the function of absorbing nutrients. So, people don't understand that if we do the right thing, take fiber and all of that, your guts are going to move much better, and you don't have to be constipated.
I mean, figs, now figs are fresh. The fresh figs are fantastic. So I'd had about 8 or 9 figs, and it was fantastic. I mean, I love to eat all this kind of fruit, and I think it makes a big difference. But I guess
I have prunes. I usually have prunes in my fridge, just there.
Yeah, right.
Now, the thing about figs and prunes is that you always want to have it at room temperature. You know that? If they are cold, I remember, I never forget this, when we studied the gut in medical school, we would take a little bit of hot water, and we pour hot water, and you see that the intestines start moving really fast with hot water.
Right.
If you put ice, the intestine move very slow. So this is the yin yang. I said when I explain this to my parents, they say, "Of course, we know that. In Asian culture, it's what we call the yin yang. So hot make you move, ice make you sleep."
You know that's really true. That's why there are people that just drink hot water in the morning. No coffee.
Exactly.
They have a glass of hot water, put a little lemon in it.
When I went to Malaysia, and they bring me my breakfast, and they bring me the water in a wine cup, because it was a nice hotel, so the water was in a wine cup. And when I grabbed it, I almost burned my hand. I let go. I said, "What is this hot water?" I called the guy. "It's hot water." I say, "Everybody got hot water. We drink hot water in the morning." I said, "Okay." So
that's
I drank my hot water. I said, "Oh my God, back to the bathroom."
That's right. Hot water does it. It's true. That's why, hot coffee, definitely. I have to give your phone number because it's about time. We've spent all this time talking about my knee and your hot water and farting.
And the open house. And cleaning the pipes.
The phone number is 954-480.
And Dr. Robinson playing the accordion.
Okay, come on. 954-489-1345. That's Dr. Mencia's office. They're open on Saturdays. We're all talking about Fridays, September the 6th from 4 to 8. Open house. I'll be there. Dr. Mencia will be there. Everyone of any importance will be there.
Absolutely.
And
you and I are there, so that's it.
Oh, yeah, right. So, and also get on their website, which is adultgeriatrics.com. And, of course, Ina has been sitting here quietly, helping us, laughing, making fun of everything we're doing. And we're working on getting an office in Boca Raton for Dr. Mencia, too.
But tell them not to get scared. I'm still going to be